Today we will be discussing the disease hepatitis B, also known as HBV. HBV is caused by the hepatitis B virus infection of the liver. It is not caused by genetics. It is transmitted through contact with infected body fluids such as saliva, blood, vaginal fluids, and semen. Sexual transmission is more common among unvaccinated persons with multiple partners. Other ways to transmit the virus is through tattooing, piercing, needle stick injury, contaminated needles reused, sharps or syringes in healthcare, or in community settings such as intravenous drug users. It is most common from mother to child at birth, known as perinatal transmission, or horizontal transmission when one has exposure to infected blood, more commonly from an infected child to an uninfected child during the first 5 years of life. When infection is more common in a community one is living in that region, it is more at risk for contracting the hepatitis B virus. HIV diagnosed individuals are more at risk by 7.5% and will develop chronic HBV. Intravenous drug users were also noted at risk as rates of infection in the US were recently elevated due to the opioid crisis. Those of African, Asian, or Pacific Island descent were also noted at risk as the rates in those countries range between 2% and 8%. And these communities living in the US make up more than half of those diagnosed with chronic infections. AI models that use data mining for HBV from Lyme Disease Control and Prevention Center include ANN and ARIMA. Another model that uses data mining to forecast incidents from local health websites that are approved by the Local Health Commission is the ELMAN-NM. Most likely to develop HBV include infants born with the hepatitis B surface antigen, HBsAg, from positive pregnant mothers. Those born in regions with infection prevalence of less than 2%. Unvaccinated US-born people born in regions that have a prevalence of less than 8% for HBV. Drug users and needle sharing, those incarcerated in jails, prisons, or detention settings, HIV-infected individuals, those who have hepatitis C virus, sexually transmitted infection, or sexually transmitted infected, or one with multiple sex partners, having maintenance dialysis in in-center or in-home settings, household contact with people who have HBV infection. In the US, 2020 showed a total of 2,157 cases for acute HBV with an overall incidence rate of 0.7 cases per 100,000 population. After corrections and adjusting for underreporting, it was estimated by the CDC that a total of 14,000 acute HBV cases occurred in 2020. Globally in 2019, newly infected was reported as 1.5 million people for chronic HBV. The United States is estimated to have 580,000 to 1.7 million people diagnosed with HBV, with two-thirds who may be unaware of their infection. Chronic HBV disproportionately affects non-US born individuals. 14% of the US general population is accounted for, while non-US born people account for 69% for chronic HBV. Globally, in 2019, a total of 296 million people were diagnosed HBV. Hepatitis B is a viral infection that causes inflammation of the liver. located in the digestive system of the body, leading to a necrosis of liver tissues. Liver tissue is a connective tissue capsule branching throughout the liver and forming septa that divide the liver into thousands of hepatic lobules, which are the structural and functional units of the liver that contain liver cells called hepatocytes. The liver is the largest organ in the body and is posterior to the ribs in the upper right portion of the abdominal cavity. It has a triangular shape, dark reddish-brown color, and consists of two main lobes. If the liver fails, one can only survive 1 to 2 days, making this a vital organ. Functions of the liver include storing vitamins, sugar, and iron for energy, having control over the production and removal of cholesterol, the production of bile to aid digestion and absorption of nutrients, detoxing the blood of waste products, drugs, and poisonous substances, clotting factors to stop excessive bleeding after injuries or lacerations, immune factors and removal of bacteria from blood to fight off infections. Figure 1 shows the normal liver histology. The outer surface is a fibrous connective tissue capsule with the outermost surface covered by a thin layer of mesothelial cells arising from the peritoneum. Figure 2 shows the liver tissue with a diagnosis of HBV. The HBCA stain reveals nuclear and cytoplasmic positivity in the circled and red-pink regions. A healthy liver is a soft and flexible, but when it is under attack by HBV, it becomes hardened over time. This can lead to fibrosis, where the liver forms scars in an attempt to repair itself after inflammation, making it hard for the liver to function properly. HBV can cause cirrhosis, where the liver has larger regions of permanent scars with nodules forming. Blood is unable to flow freely through the scarred liver tissues, causing the liver to shrink and harden. When cirrhosis is severe, liver failure follows. The liver is unable to detox or produce clotting factors, leading to death. Liver cancer is also a result from cirrhosis, as the damage to the liver cells alter genes inside the cells, making them cancerous. Key metabolic pathways in hepatocytes are disrupted. Glucose and lipid metabolism is dysregulated. The abnormal lipid accumulation and increase of glucose uptake drives the end stage of liver diseases and hepatocellular carcinoma, also known as liver cancer. The majority of people with HBV do not experience symptoms when newly infected. Symptoms of HBV include jaundice, which is the yellowing of the skin and eyes, dark urine, fatigue, nausea, vomiting, and abdominal pain. Severe cases lead to liver failure or liver cancer, leading to death. Symptoms vary by age. Children under the age of 5 and infants, including immunosuppressed adults with acute diagnosis of HBV, are generally asymptomatic. People under 30 tend to be less symptomatic in comparison to those aged 30 and over. Commonly in low-income settings, people are diagnosed with liver cancer late in the course and die within a span of a few months. In higher income countries, patients are diagnosed earlier, giving them accessibility to chemotherapy, which can prolong their lifespan by several months to years. Within the 5-year survival rate, patients diagnosed with liver cancer with cirrhosis have a rate of 10% to 14%. For patients who have had small tumors removed without cirrhosis, have a survival rate of over 50%. For patients who are in the early stages of liver cancer and are able to receive a liver transplant, that rate ranges from 60% to 70%. The mortality rate for HBV in 2019 was estimated at 820,000 deaths and was primarily linked to cirrhosis and hepatocellular carcinoma, which I did note earlier as liver cancer. Diagnosis methods include several blood tests that are also used to monitor patients with HBV. The labs are able to differentiate acute and chronic infections, including the severity. Physical exams, ultrasounds, and fibroscans are also a part of those diagnosis methods. On the right-hand side, I have a photo of a patient receiving a fibroscan. Fibroscans are able to monitor the progression and degree of liver scarring from fibrosis. In comparison to traditional serological tests, the AI model Raman spectroscopy showed an improvement in performance. Raman spectroscopy uses recognition technology and infected samples from the histopathology department to diagnose HBV. Prophylactic treatment for HBV is the hepatitis B vaccine, which has been proven to be the most effective preventative measure. The vaccine for those who have not been previously vaccinated is given within 24 hours of exposure and needs 2 additional boosters over a 6-month time span to be fully vaccinated against HBV. To prevent infection in those recently exposed, another treatment includes hepatitis B immune globulin, HBIG, injections that is made from human blood and consisting of natural antibodies to HBV. Acute treatment includes supportive care such as intravenous fluids, IV nutrition, and pain relief. Chronic treatments do not kill the virus, but do slow down the rate the virus is able to reproduce itself. Chronic treatments include immune modulator drugs that are synthetic versions of the antibodies our bodies normally produce to combat infection. Antivirals are used as the most potent drug to suppress HBV. Surveillance of the virus is done through blood tests, imaging, elastographies, which are able to identify an organ stiffness. Lifestyle changes consist of healthy diets and avoidance of alcohol, sugars, and fats to reduce inflammation. Surgical intervention for chronic HBV includes the removal of all or part of the liver and liver transplants. Treatment, especially during earlier stages, is beneficial by slowing down the progression of cirrhosis, reducing the chances of developing liver cancer, and increasing the long-term survival rate. Surgical intervention presents risks including infections at the site of incision, urinary tract or lungs, bleeding excessively leading to blood transfusions, bile leakage inside the abdomen requiring an additional drain to be placed, pleural effusion where fluids build up in the chest causing chest pain and shortness of breath, ascites where fluids build in the abdominal cavity, deep vein thrombosis, a risk as bed rest for long periods of time leads to blood clotting. Kidney failure and liver failure present a risk as well. In cases where surgical complications are too severe, about 2% of people who have the liver resection die. There is currently no cure for HBV, although the best way to prevent contracting the virus is vaccinations. Depending on the case, as it varies, some may only experience an acute or short-term illness, while others develop chronic infections. And these are my references. Thank you.